Hi, I'm Dr. Steve Goldstein. I'm speaking to you here from New York, where I'm a tenured professor at the New York University School of Medicine in the obstetrics and gynecology. I've been in the field of women's health for more than 35 years. And I wrote the second book ever on vaginal sonograms, the first book ever on gynecologic sonograms. I've been president of the American Institute of Ultrasound and Medicine. I then pivoted into perimenopause and menopause. I wrote a layperson book on perimenopause 28 years ago when nobody knew what it was. I wrote the first medical textbook of perimenopausal gynecology 24 years ago. I've been president of the North American Menopause Society, which is now renamed the Menopause Society. I've been president of the International Menopause Society. So why am I here? Why am I talking to you? I'm concerned. When I was president of the Menopause Society for many years, the membership hovered at about 2,000 healthcare providers. Now it's way above 10,000 people. Everybody wants to be a menopause doctor. Everybody thinks they're an expert. And the amount of poor quality information that's out there, the amount of misinformation that's out there, I feel I'm not selling anything. I'm not selling supplements. I'm not selling books. I'm not selling mailing lists. It's just what my career has been all about. And I feel an obligation to try to share some of the wisdom that I've learned. I don't have a personal experience. There's an advantage to being a male gynecologist. Never going to have a menstrual cramp. I'm never going to have labor pain. I'm never going to have a hot flash. My experience is everything that my patients have told me for 35 years, and it's this broad a range. A lot of people think if their doctor's a woman, they'll understand what they're going through. But if I have my experience, it could be 180 degrees different from your experience. One of the worst things a healthcare provider can do is to put their own experience onto the person sitting opposite them in the consult room. So yeah, I have a lot of experience and a lot of wisdom, and I've done a lot of teaching and a lot of learning, and I want to be in a position to share it with you.